So an issue that women get particularly, and I see a lot of in my clinics, is vaginal and genital dryness. Now, vaginal and genital dryness are incredibly common in the normal population, and as many as 3/4 of women will suffer from this post-menopause. But obviously, if you've got an underlying connective tissue disease, particularly if you've got Sjogren's, but also with scleroderma and lupus, you may well get dryness at a much younger age. And it is a problem because it's not only uncomfortable, but it can make you more prone to infections. So if you've got dry skin, then you're likely to get tears and cracks in that skin, and that can allow infection in, and it can allow thrush to develop as well. There are a few rules about looking after genital skin. Don't use ordinary soap, use what we call a soap substitute. So these are far gentler than standard soaps. They're usually liquids, and many of them you can buy over the counter. Some of them are on prescription. So Oilatum's a good one, and so is Aveeno. And I've put those two examples in on purpose because Oilatum is a very traditional paraffin-based moisturizer and emollient. Whereas Aveeno is an oat-based moisturizer, and they both have a whole range of products, including bath, stuff you add to the bath, stuff you wash with, and stuff you use as a moisturizer. Most people will try the oily-based, paraffin-based ones first, and they do work very, very well, although you do have to put them on regularly. And you do have to persevere. 1 or 2 people don't find the paraffin ones particularly helpful, and some people find them sensitizing. They make them actually worse rather than better. And if you're in that group, you might want to try an oat-based moisturizer. So these are produced in a different way using oats. Aveeno is probably the market leader, but there are a number of them on the market. And if you walk up and down the aisle in your local pharmacy or Superdrug or Boots, whichever one you use, you'll find different ones. And GPs can prescribe versions of Aveeno or oat-based moisturizers, and they can be really very helpful. The next thing to point out is that if you're using a moisturizer within the vagina, it is absolutely critical it's acid based. So most of our skin and our mouths and so forth are alkaline or neutral pH, but the vagina is very specifically acidic, and that's important because it's designed to be acidic, and if it loses that acidity, then that can make you particularly prone to thrush or to something called bacterial vaginosis, which is where you get bacteria overgrowth. And if you do get that, it can be quite unpleasant because you can get a discharge down below, which can smell sometimes a little bit fishy. So if you've ever experienced that, you'll know that it's not something you don't want to get again. So use an acid-based moisturizer. Now, again, there are some really good products on the market, many of which you can buy over the counter or online if you find it difficult to go into a chemist and ask for these products. Probably the market leader is one called YesVM. It stands for Yes Vaginal Moisturizer. It's very discreetly packaged, it's very easily available, and it's very effective. And some versions of this will be available on prescription if you talk to your GP. If you get a lot of vaginal problems and you are postmenopausal or even in those perimenopausal years, you might benefit from an estrogen-containing product as well. So if you look at what actually happens to the genital skin postmenopausally, the thickness of the skin reduces dramatically. The skin becomes thinner. And if you've got thin skin that is dry, it's very prone to tearing and cracking. So using an estrogen-based topical moisturizer, and there's various ones on the market, or a pessary, which is where you insert into the vagina, can make a big difference. And I do have a lot of patients who will be using a estrogen-based product and a moisturizing acid-based product. And what I normally recommend is if you're starting a new estrogen-based product, you use it regularly for a couple of weeks just to improve the quality of the skin, and then you reduce it down and maybe use a maintenance dose twice a week. A couple of other very simple things you can do. Please stick to cotton underwear, because nylon underwear can make you sticky and it can encourage thrush growth. Obviously, avoid perfumed products down below, and be aware when you're buying sanitary products that nowadays some of the panty liners and sanitary products have got perfumes in them, so try and avoid one that's got perfumes in. And then another top tip is to avoid very dark colours. The dyes they use in some underwear, particularly the black dyes, the very deep black dyes, can be very irritant to sensitive skin. So switch to lighter colours or white underwear.